So now I'm going to pass over to Sue, who I'm sure has a very interesting session plan for us.
I do, and I am going to try and do this in 30 minutes, give or take. So yeah. So the topic is why community matters, because it's Mental Health Awareness Week and community is the theme for the week. I really like this definition of community. It's a group of people living in the same space or having a particular characteristic in common. And for me, that kind of encapsulates the kind of the heart of what I want to talk about. It's the how does having a pituitary condition affect your family life, so the group of people living in the same place, and what does that mean in terms of your being a member of a group that has pituitary conditions, so that particular characteristic that potentially you have in common. So I have an admittedly strange way of looking at the world. I freely admit that. We actually have to learn to live we have to learn how to live together as families. You may well not necessarily be aware that that's what you've been doing or what you do, but we have to learn how to fit together. I call it the dance of the everyday. It's that kind of all the things we do. We have a general sense of who does what and how they do it, and we know what kind of things annoy them, and we know what kind of things make them smile, and we kind of know how to fit together. And yes, it shifts and changes as people grow and as they age, etc. But by and large, we have a sense of how our day-to-day life goes, the dance of our everyday. An awful lot of what we do becomes second nature or habit. And so psychologists tell us that anything up to 95% or maybe even more, we don't really think about it, we just do it. It's kind of like we're really cool and we can kind of work around each other. The problem can come where someone is, in this case, diagnosed with a pituitary condition, and that disrupts our rhythm of life, not just for them, but also for family, for friends. And if that person is working also for work colleagues, it can have quite far-reaching effects in terms of the impact it has. It can be salutary to remember, and healthcare professionals should also remember this, that most of the management of long-term conditions like pituitary conditions is actually done at home or in the workplace if the person has a workplace. By generally speaking, probably not medically trained people, just ordinary people doing ordinary things. It's a very small percentage of care that's actually done in medical settings across someone's lifespan. So most of it, we're trying to work out how do we do it within the dance of the everyday. And it's very unsettling having your dance messed up. So we live in communities, and various communities can react in various ways. So family and friends may well be focused on just being grateful that you're still alive. Endocrine specialists can be focused on the medical management of a condition. There are some problems though, because other communities that you may well belong to, so other healthcare professionals you may access in other spaces that are not specialist care, and the wider general population may not have heard of a pituitary, don't know what it is, and certainly don't know that there's a whole suite of conditions that can come along with it if it goes wrong, if you get a tumour. And this can actually leave, if you're the patient, can leave you feeling quite isolated and lonely and cut off and out of step with your communities. And that's not a happy place, not a good feeling. Journey through treatment varies for individuals. For some people, it is relatively straightforward. I'm a psychologist. I very rarely see people for whom things are straightforward. I have to keep reminding myself that it is a thing that does happen. Some people, it is, you have the symptoms, you go through testing and diagnosis, and kind of, you follow it in a neat and tidy fashion through surgery, etc. That's not to say it's easy, but for some people, it is like a one-stop thing. You kind of just go through it and pop out the end. And yes, the chances are you'll be changed by that process, but it's kind of, for some people it's a linear process. For others though, it's a little bit more complicated, and some of the conditions can recur, and so you find yourself going round and round in circles, and that's really challenging for people. I think the other thing to bear in mind, and the kind of big thing really, is diagnosis itself can actually be quite stressful and traumatic. I know my medical colleagues are very careful, and they try to be very careful in how they convey a diagnosis to someone. But hearing that you have got a tumour, most people, when they hear the word tumour, think cancer. Having a tumour in your brain is terrifying. Thinking that you've got a brain tumour in your brain, it is really, you know, it's just, it can't get much worse than that for an awful lot of people. And that can be very traumatic for people and very stressful. And unfortunately, that kind of traumatic stress affects how we can pay attention to what people say to us. So an awful lot of patients tell me that they found the process of diagnosis very stressful, and the doctor conveyed the diagnosis to them, and then they were so stressed they couldn't remember anything else that the doctor said. But then that patient has got to convey that information to other people, to family, to workplace, etc. So it can be tough from the get-go. So it being Mental Health Week, I thought it might be useful just to kind of have a brief reminder. So we have stress. I tend to think of anxiety as kind of existing along a continuum, but that's just in my head. It's kind of, it doesn't actually exist along any kind of continuum, because you can have things that are a little bit stressful and things that are extremely stressful. But hey, for the purposes of this, so you can have stress down at one end. So that's kind of everyday kinds of stress is why I've got it down that far end. Anxiety is worrying about things. There are different flavors of anxiety. And PTSD is post-traumatic stress disorder, which is where someone has been traumatized by something. As I say, diagnosis can be very stressful and traumatic, not just for patients, but also for family members. And it can be delayed. And if you're not sure whether you have been traumatized by something or not, I've put the symptoms on this slide. And if you're not sure and you want to talk to someone, then you can take this list and go and chat to your GP, and they should refer you on into mental health services, because there are good services now in pretty much all of the country to help people who've got post-traumatic stress disorder. We talk about trauma-informed care for mental health, and it's really important, and it exists for people in more places now than it ever used to. So in terms of community, if we think about life changes, I'm not suggesting with this quote that a pituitary condition is going to kill you. There are some that are actually quite risky, and where they do put you, if they are mismanaged, yes, it can. But Judith Herman's book about trauma recovery is really interesting, because one of the things she talks about is how important community is. And she says, in ordinary bereavement, numerous social rituals contain and support the mourner, but by contrast, there's no custom or common ritual that recognises the mourning that follows traumatic life events. And that has implications then for people who have pituitary conditions, which are traumatic and they are significant life events, and also for the family and friends of that individual. So it's an socially isolating and discombobulating experience. There's a process of adjustment that we go through. Normally, when we teach this, or when I teach this to psychology students, we have it all drawn out in nice, neat little boxes, and there are little arrows between them. In reality, it's a mess. It isn't a neat and tidy process. It lands like a splat, and anyone can be anywhere at any given point in time. The patient and their family can be all over the map. Day on day, it can vary. Reactions can vary day on day. Things will settle down, hopefully, over time, but there can be disruptions. And there can be difficulties within communication because you're in different boxes at different times, and so you're offering assistance to each other and you're assuming that someone else is in the same box as you, and you may well not be. And that's where some of that comes from within families, within communities, because we're not understanding. We mean well, but it's going a bit pear-shaped. So the other thing that Judith Herman talks about within the idea of community is the importance of sharing with other people. So she says that sharing the traumatic experience with others is a precondition for the restitution of a sense of a meaningful world. And she talks about how the role of the community, it's got this really powerful influence in terms of how things come right again, how they can be made right again. But it's for health conditions, it's actually really quite complicated. So first off, we have the issue that pituitary conditions affect everything that it means to be human. So they affect and change the way you think and feel about things, the beliefs you have, potentially about how the world works, and your place in it, because what you may be able to do might be profoundly changed by having a condition because of the side effects of it. It can change how you feel about yourself and about your place in the world. It affects your body state for sure, and all of it can massively impact on what we say, what we do, our behaviour. So it has far-reaching effects, and because for some people the effects are so far-reaching, particularly in terms of psychosocial impact, you can end up with that box, that unhappy box on the right-hand side there, where it does undermine your sense of self and your self-esteem. And so you end up believing some very horrible things about yourself, really, that you're bad, that you're worthless, because you can't do the things that you used to do in the same way that you used to do them. And that kind of gap between who you were and how you are, and then how do you explain that to other people, and then other people maybe not believing you, and that's a difficult thing. That's a really, really hard thing. In our society, we have beliefs about how someone who is genuinely sick, genuinely unwell, should be behaving, and this research comes from the 1970s by a psychologist, actually I think he's a sociologist, called Parsons, and by and large this is what people expect, that if you're properly poorly, then you're not going to be doing your daily activities. You have symptoms that other people will recognize. You're going to want to get better. You'll seek professional help. You'll follow that advice and those instructions. And time limited, that's a really important one. There's this expectation that at some point you're going to return to normal activity at some point. And chronic health conditions are nothing like that. And we don't have anything societally that helps people to understand what's the difference between someone having flu and a broken leg versus a condition that goes on forever. As humans, we're very good at cyclic things. We're good at the idea of something being one way and then going back to being another way. So the sun comes up in the morning, goes down at night, and it comes back up again the following day. You get flu, you get better again. With long-term health conditions, wrapping your brain around the fact that someone is going to have this thing and it's not going to go away. So then the idea is, well, how long is it reasonable to expect them to have kind of got themselves together? Just like in bereavement, people who have no experience of long-term health conditions, their expectations about what point you should be able to kind of cope bears no relation to the actual lived experience of patients who have pituitary conditions. So it's almost like they think the doctors and such can wave a magic wand and make it all right again, and it doesn't work like that. But if they have no experience, then they're not going to know that. So this is another reason why there can be a dislocation for patients and their families away from their communities. So complex long-term health conditions are nothing like acute ones. It's a series of events that I outlined earlier on that slide that can be linear or circular. It's definitely a marathon and no kind of a sprint. there's probably there is no cure, it's just treatment. And that means regular checkups and concerns between appointments. There's going to be medication, which may well need monitoring and adjusting for various things over time. Long-term conditions need to be managed. We do have this thing, and we talk about this quite a lot within patients who have cancer, the idea of battling or fighting cancer. And I know some people with pituitary conditions also think about it in the same way, but that's not the right way for everyone to think about it. And particularly if you've got fatigue or struggling with that, the idea of battling or fighting when you've got very little energy can be too much for people. So management might be an easier way to think about it. Something other people might really not understand is the unsettling anniversaries that you might experience. And diagnosis and such is like dropping a stone in a pond, and it ripples out. And it ripples out over the years, and you can be surprised by how it can affect you in subsequent years. And other people may not understand anything about your condition and how it affects you. They might not understand that it fluctuates. They might not understand that they can't tell how you are just by looking at you, that you might well be looking fine, but that you're feeling really grim. Your condition affects not just how you are physically, but psychologically and how you feel about yourself as a person. That your healthcare needs are complex and frustrating because of the way the NHS works. So patients don't actually have a whole lot of control and agency because of the way our systems are set up. So it's difficult. So what can happen is the dance of the everyday within family units can get significantly disrupted. In the short term, if someone's very poorly, we do what we call dancing attendance on them. So we kind of absolve them of all the routine, regular stuff they would normally do, and we look after them. The trouble is with long-term health conditions, that's not actually a very good way necessarily of managing it. It's quite good for short-term things, doesn't work so well for all kinds of reasons for long-term conditions. So this is just a little summary that says that pituitary conditions, one way of thinking about them is that they're a form of hidden disability because they are so difficult for other people to understand. And there's a lot about it that isn't straightforward and amenable to easy explanations to other people. So in terms of communities, what's a helpful, beneficial community? What does that look like? So the idea of a shared identity, having somewhere where you can go and talk to other people, and there is a huge amount of psychological relief that comes from knowing that it's not just you that finds it difficult. It is not just you that finds it confusing. I think sometimes when patients have contact with healthcare professionals, we have this sense of, and the way things are done is there's this expectation that you should just be able to get on with it, and it's no big deal, and why are you making a fuss? But it's the first time you've gone through an awful lot of these things, and so it is going to be hard and it is going to be difficult, and particularly if you've been shocked or traumatized by it. It doesn't mean that if you're finding it difficult that you're pathetic in some way. It is a hard thing. Pituitary conditions are very, very challenging to live with. And it won't be just you. If there are questions you have got, you can pretty much guarantee that there will be someone else within the pituitary community who's got the same question. And there can be a lot of relief in knowing that it's not just you. The community within the Pituitary Foundation can help give you support while you find your way through. And I think pituitary conditions are particularly challenging because they are so complex, and you have to become expert really quite quickly. And the pituitary community can help you to do that, because the number 3 there, that sounds very grand, doesn't it? You have overlapping experiences. So it's not just you anymore. The distributed intelligence is a fancy way of saying that if you're talking to other people who have pituitary conditions, your experience of that condition is broad because you are lots and lots of different people. and you have different experiences that you can share, different knowledge that you can share. Healthcare professionals see the same bit of pituitary conditions over and over and over again. So while they are incredibly knowledgeable about certain aspects of it, they're doing the little tiny bit that happens in a hospital setting. They have absolutely no idea, unless they have a pituitary condition themselves or have a family member with one, what it's actually like to take that condition out into the real world and actually have to live with it. But all of the other people who have pituitary conditions do know what that's like. And beneficial communities also have this normative thing. So again, that's me repeating myself, the idea that it's not just me, but it can also help in terms of getting some sense of, for instance, what are useful questions? Which of the many different kinds of healthcare professionals that you're going to have to talk to, which questions do you ask of which one in order, and which ones, so helping you to kind of navigate your way through that experience, and normalizing the fact that sometimes those conversations with healthcare professionals are really challenging. And again, it's not that you're doing it wrong, it just is difficult. And the idea of moral force, the idea that the Pituitary Foundation does an awful lot of campaigning to try and effect change, to try and keep improving things for patients, because it's important that we do that. Hospitals are not very good at the psychosocial support aspects. There are any number of medical charities in the UK that exist because the NHS is not able to provide the kind of support that people actually need, and those connections to other individuals that they also need. So we can kind of think about really working this dance metaphor here. So your dance of the everyday, the way I think about the Pituitary Foundation, kind of those kinds of support charities, it's kind of like doing a country dance or a folk dance. You're being introduced into a new country, if you like, Pituitary land. And the other people who are already there can kind of help you learn how to work your way through this series of interactions you're going to have with different healthcare professionals. And they can help support you while you kind of work your way through that. So in my head, that's kind of, and these two things are not mutually exclusive. You can do the dance of the everyday, albeit in changed fashion, but that having that other group that can also help. The other thing that's also beneficial and also helpful is thinking about other communities that you can connect with, because there can be an awful lot of shame and guilt that comes with having a long-term condition. And also for family members, there can be a lot of shame and guilt. We kind of expect, and we are told, that we should be able to do all of these things. And we might be very, very acutely aware that we are not doing it very well, and that's not very good for our self-esteem and our well-being. And having other groups that we can connect with other aspects of our identity can actually be really, really helpful. So communities don't have to be just home and work and your pituitary condition. There can be other kinds of communities that can help you feel better about yourself, because they identify, or they help you with other parts of your identity, keep those parts of your identity working. So this is for me. I have a chronic health condition. I'm also a carer for my husband who had a stroke. I regularly feel that I'm not doing very well on either front in terms of managing my condition, or indeed supporting him and helping him. But these different groups that I belong to actually help. So I belong to a couple of book groups and a couple of sorry, my cat's on the move. 3 writing groups, in fact, and a couple of professional bodies. And they help me to see myself in a different way and to help keep me functioning. And that might look like a lot, but actually all of this is done online as and when. I connect with people who understand that I have a chronic health condition and I have caring responsibilities. And so they understand that I will bop in and out and I won't always be able to do everything. And that's an important part of it, is having other communities that you connect to that get it, it's not the main focus of why you're meeting with them. So you may want to map out and think about who else and what else can I connect with to help. And I am a big fan of the poetry pharmacy, because poetry speaks to us in a way that, some other things may not. This particular poem is called The Life That I Have, by Leo Marx, and it's about community. It's about how we live in community with one another. And it reads as follows: the life that I have is all that I have, and the life that I have is yours. The love that I have of the life that I have is yours and yours and yours. A sleep I shall have, a rest I shall have, yet death will be but a pause, for the peace of my years and the long green grass will be yours and yours and yours. And what William Seagert, who writes the poetry pharmacy books, says: it reminds us forcefully and beautifully that our lives are never wholly our own. We live in families and communities, in networks of love, duty and care that make demands of us in exact proportion to the nourishment they offer. Although I would comment, where we have long-term health conditions, that can get thrown out, and that's part of the problem. The capacity to love broadly, beyond just ourselves and our own ends, is perhaps the greatest of all of those that make us human. And as Leo Marx recognises, it's most fundamentally a capacity for giving. So when we learn to look outwards with empathy and care, when we allow others' needs to take an equal urgency to our own, then we can begin to rationalise our feelings and recover a sense of scale. And more simply, helping other people feels good. So this is a poem about our capacity for love and how far it goes beyond the romantic. It's about abstract love, the love we can have for those we have never met and perhaps never will meet, and yet which is no less intense for its broadness. If we can tap into this love, which really is a love for humanity over the individual human, then no revolution even, no sacrifice should be beyond us. So it's that if you have a chronic health condition, there are limits to how far you can take that, but this sense that we belong to a community and we are just as much an important part of the community, whether we have long-term condition or not. But when we have got a long-term condition, working out how to do this can be a challenge. And there are sources of support. So Pituitary Foundation has got all kinds of things. So there's helplines, there's telephone buddies, there's its counselling service. There are local groups. There aren't local groups across the whole country, but there are a fair few. They do regional get-togethers, and one of the things I'm particularly fond of, some of you may know, I write articles for the Pituitary Life magazine, but there are also patient stories in there about people's experiences of living with various of the pituitary conditions, and that's important that we hear each other's stories, because that's how we make sense of things as humans, is through our stories. And actually fairly shocked that I have actually managed to do it within the time requested.
Amazing. Thank you so much, Sue, for another incredibly interesting and